There is a line that should never be crossed in healthcare, a line between medicine and politics. And this week, that line was shattered. A major legal conflict erupted when a state attorney general demanded that a hospital system resume gender-affirming treatments for transgender youth after the hospital paused services. Why were they paused? Well, because hospital leadership said that they were facing regulatory uncertainty and potential federal funding consequences. So in other words, the clinicians inside those exam rooms are now standing between three competing forces: state laws demanding access to treatment, federal political pressure threatening hospital funding, and a rapidly evolving medical debate about the long-term safety of treatments for minors. And while politicians argue, clinicians are the ones standing at the bedside. They are the ones looking at the patient and the family in the eyes. They are the ones responsible for the outcome, not the politicians, not the lawyers, not the headlines, the clinicians. And this is where the real crisis begins. Because when politics enters the exam room, clinical judgment becomes collateral damage. Across the country, healthcare professionals are asking the same question right now. Are medical decisions being driven by politics or by evidence? And here's the uncomfortable truth. When governments pressure hospitals, hospitals pressure administrators. Administrators pressure physicians and nurses. And the people left carrying the weight are the ones who took an oath to protect patients, not serve political agendas. This is not about ideology. This is about professional autonomy. Medicine must remain grounded in evidence, ethics, and individualized patient care. Because when policy begins dictating clinical decisions, the entire healthcare system becomes unstable. Clinicians were never meant to be political pawns. They are highly trained professionals responsible for some of the most complex decisions in society. And when those decisions are hijacked by political pressure, something sacred in healthcare begins to erode. So what happens now? The future of healthcare will depend on whether clinicians are allowed to practice medicine based on science, ethics, and patient-centered care, or whether exam rooms become battlegrounds for political agendas. The public needs to understand this, because if politics can control one medical decision, it can control them all. And once that door opens, it never closes. Healthcare professionals must speak clearly about one fundamental principle. Medical decisions must be guided by clinical evidence and patient safety, not political pressure. Because when the exam room becomes political territory, patients are no longer the center of healthcare. Politics is. And that is a dangerous place for medicine to go. The question now isn't just about one hospital or one treatment. The question is much bigger. Who controls medicine, clinicians or politics? And every healthcare professional in this country knows the answer to that question will shape the future of patient care.